So there have been a lot of amazing clinical trials, a lot of amazing individual sessions. It's kind of shame that you can't participate in all of them because they're happening at the same time. But if I would have to mention a few, I would definitely say that, for example, the TRACE-3 trial, now we have TRACE-1, TRACE-2, and now we have the final end of the trilogy, which compared basically Tenecteplase in patients versus best medical treatment. And the results from the TRACE trial were positive, which is very promising, and it kind of goes in line with the other trials on Tenecteplase. There was also a colleague from Greece who presented the revised systematic review and meta-analysis on the Tenecteplase trials, where they included 9 Tenecteplase trials, and there was also a significantly higher association when you compare Tenecteplase and Alteplase to better outcome and also very comparable characteristics in the side effects such as hemorrhage or mortality. So that was actually really interesting to see. And also tomorrow we have another session on Tenecteplase, which is kind of promising, and I think we're moving more and more towards this lytic. Another study which I might mention would be maybe the SWITCH study. The SWITCH study actually took kind of a long time, almost 10 years to finish, because the patient, it was really a specific patient cohort, because the SWITCH study kind of investigated the effect of among patients with large hemorrhage, does decompressive craniectomy plus best medical treatment that have any better or worse effect versus best medical treatment alone. And what the study investigators from the SWITCH study have shown is that when you do decompressive craniectomy in these large hemorrhage patients, you can basically expect a better outcome on the MRS scale. However, this better outcome is marginal in a sense that the highest increase, yes, the mortality is lower, but the disability still remains, because we have to keep in mind that these are, after all, large hemorrhage patients. So even though you do decompressive craniectomy, the patient is expected to stay disabled. So the results of this study should be taken into consideration when talking with patients' families and to kind of set the expectations, what is really going to be expected. Because yes, if you're going to do the treatment, the patient is going to survive, but there is a very high likelihood of having permanent disability. So those are some kind of the interesting studies on the randomized clinical trial sessions. And I think it's very exciting to kind of see what the next year ESOC sessions will bring, because I think we're moving kind of towards this Tenecteplase pattern more and more. Another interesting study was the TRUTHS trial, which was done by the colleagues from the Netherlands, and where they looked at the blood pressure monitoring values basically in is there a difference in patient outcome with aggressive blood pressure lowering versus normal blood pressure lowering? And actually the expected hypothesis and what we kind of saw in observational data, if you lower the blood pressure aggressively, you can expect a better outcome, because then you kind of stabilize the patient. However, what the authors have reported is that the group which had not aggressive management of the blood pressure actually kind of did better, at least when you look at the 3-month outcome and disability, which is actually really interesting. And I'm really looking forward to the discussion on this topic, because there have been a lot of discussions. Should the blood, like also previous years from the previous trials, should the blood pressure be lowered aggressively or not? So now we have some kind of a different results. So I think it's going to lead to an interesting discussion. Of course, sometimes in the future, it would be very interesting to see kind of literature review or maybe even a systematic analysis, if possible, of these trials to kind of see in which direction we are going. Because, for example, with Tenecteplase we know, but it would be also nice to know with the blood pressure values.